very bright of you guys not to start your own grow operations because of how much capital it really takes, time, effort, and then there's so many pitfalls that can come along with trying to start that, with getting that up and running, the different bugs and mold issues that you can run into, and that level of expertise that you need. So if you set it up kind of the way you guys are, as this kind of skeleton, and then being able to import from overseas, I think it's very strong at the moment, instead of trying to outlay all that money.
I'm definitely, one thing my time in Washington State definitely taught me is that I don't want to be a farmer. So like, it was, not only do I not want to be, at the farm washing the grow, but I also just can't be bothered capital raising at this point either. And it's like, I understand that you need capital to do stuff, but we've managed to do what we wanted to do without a lot of it, or, enough that we can personally finance these initial stages. So from our perspective, it's not about being the biggest and the best. It's not about being the largest Australian GMP, blah, blah, blah. And I'm sure that floats a lot of people's boats. But for us, we know that there is people who need cannabis products for their health. We know that not all products are the same. And we know some people really don't, like, they receive this, I guess, single spectrum or isolated oil type products, and they're okay, but it actually gives cannabis the wrong name when people try it, like, oh yeah, it didn't actually work for me, but they haven't actually had a product that really is therapeutic in the sense that it has an entourage effect of all these phytocannabinoid profiles that help people with all different terpenes and flavonoids playing their little part. And we have just an exceptionally beneficial position of having easy access to that. Why wouldn't we exploit that? It just made sense to us.
Now you give them some insight into your history, your past, and your qualifications and things like that. And I think you two are very interesting and well positioned within the industry. So I'm really excited to hear more just about you guys and what you're involved in.
Well, Mitch and I have been best mates since high school days. So we met almost 20 years ago, and we actually met rowing together. Mitch used to call orders to the rest of the boat, and I was...
You meant in the boat, or I thought you meant arguing?
Well, there was that too. But, since that time, I think we've both grown up quite a lot. We're still the same, but we've changed a lot. We don't row anymore. We've gone from sort of row to grow, actually. Well, we're not cultivators, but you get the gist. But no, so I think Mitch and I have had very different lives since high school. So I'm a lawyer. I spent a few years just figuring out what I wanted to do, and then settled on law. Went through law school, and while a lot of my colleagues were going off to become criminal lawyers and family lawyers, I decided to go down a more, what some would say is a conventional path, but I work at a big commercial law firm, and I work in commercial disputes, but I did some training across corporate and construction practice groups, and I'm now an associate in that litigation team, and I think I have to say this is where Mitch has got me completely covered. His background story is a little bit more colourful than mine, but I did play in a band once. I'm now trying to think of some redeeming features of my story, but I think Mitch has got me covered, so I'll hand over to him to tell you about his colourful journey.
Where do I begin on mine? I mean, yeah, we met in 2003? 2003 we met. Friendship kicked off 2004, I reckon, mostly. Unless it was earlier and I just don't remember.
I was friends with you in 2003, I think. But
yeah, well, it was a one-way relationship at that time. Anyway, Andrew would have already known that my family was deeply involved in the cannabis space already. I remember going back since I was born. Every time I'd visit my cannabis uncle overseas, and visited the farms as early as late 90s, 95, 97, 98, 2000. I was on his farm in Switzerland already in the big THC crops that he was doing over there at the time. So it was weird. It was never really a taboo subject or kind of field for me. It was just, oh yeah, that smell. I know that's my uncle's smell. One of the smells of the world.
In high school, I'm sorry to hijack this, Mitch. I remember in year 11 or something, or year 12, Mitch went overseas and he came back and he had some photos from his trip, and there were all these greenhouses that he was visiting, and it just completely blew my mind that this was his uncle, and he's got hair down to his bum, and it was just hilarious. Very different to my family. A bit jealous, actually.
Yeah, your family shit. Anyway, but it was definitely unconventional of sorts in that respect. I then went on to do quite a few different things. I've had a career mainly between music and cannabis, and the music part dominated that early kind of university field. I know I was a bit of a DJ around town, and then did some international touring with that, and was part of an entertainment company, and also now also a background music company where we do a lot of one of the largest actually in Australia. I'm still been working there, but also at the same time, when I finished doing my master's a few years ago, I decided that during that time I could study by correspondence, and I went to work on one of the farms in Washington State. So I spent 10 months in the US working in Washington State and in one of the grows in Colorado, day in, day out.
What'd you do? Sorry to interrupt. What'd you do your master's in?
Commerce.
In commerce.
So my undergrad was like arts psych, so more like the humanitarian side of the psychology vibe, and like communications, that kind of thing. And then I wanted people to take me seriously, so I got a commerce master's to cap that one off.
But you still know a thing or two about Sigmund Freud and all of that.
Yeah, and people still don't take me seriously, so it kind of worked out in a mixture of ways there. And then I went and did a little stint after that. I got finished on the farm. My uncle said it. I kind of mentioned I wanted to get involved in the cannabis space for a while, because I loved what it was doing for people and what I'd seen around the place. He said, if you want to work in the family business, you got to go do your time and actually learn what it's like at the base level in the States. And I went over there and I was on a farm with a lot of different crew, a lot of Mexican crew as well, very agricultural lifestyle. And it was in the middle of absolutely nowhere, 4 or 5 hours east out of Seattle. And basically, I would go to work on a Sunday because there's nothing else to do. Like, I was bored out of my mind in a town of about 800 people. Close to the border of Canada. And it was just, it was quite an amazing experience, but definitely a little kind of like mini MBA in cannabis agricultural practices, seed to sale kind of philosophy, including extraction, solvent extraction, CO2 extraction. We didn't do distillation there, but I was involved with who we outsourced it to. Cultivating, managing a warehouse, managing people. It was just so much. Growing seedlings, cutting clones, just everything. So definitely got a lot more hands-on rather than secondhand information there. And then I went to Colorado, where the big outdoor hemp grow is about 80 hectares, and learned a little bit more from the biochemists down there. And also Oregon, stopped by the Big Purple plantation they have over there. And then, back to Switzerland to see the rest of the operations on my way home. And then after that, just finished my master's off, went and got the opposite direction, got a job at Deloitte for a minute. I wasn't sure what I wanted to do at that exact moment because we weren't sure on the legality. It was not as it was possible, but we still didn't have full transparency over what was going on. So we we were kind of researching, and during that period, I got a job at Deloitte, and then realized that's not really for me. Tried my hand in a private equity firm, realized that's not for me either very quickly. Then I landed a job at this big music company, and then at the same time, we were figuring out just before that, we were already figuring out what we wanted to do, and we were certain of the direction we wanted to go. We felt that because of my family connections, we had a big leverage point with a product that was already far superior to a lot of stuff that was out there based on its cannabinoid, terpene, and flavonoid profile. Still, a lot of people are aware of this, but there are also a lot of people that aren't. And so we identified an opportunity to be able to bring stuff in rather than go the very expensive and arduous task of trying to start your own grow in Australia, which is extremely coveted, but it's also just requires a level of capital and energy that we don't personally like. It doesn't make sense for us because we've already got a finished product on waiting for us. So it was a no-brainer. I say no-brainer. It took us a long time to get to that no-brainer, but we ended up there, and we, with the very adept skills of Andrew, navigated what we needed to navigate and pretty much built this whole company from scratch for very minimal input, thankfully.
I think it's very, very bright of you guys not to start your own grow operations because of how much capital it really takes, time, effort, and then there's so many pitfalls that can come along with trying to start that, with getting that up and running, the different bugs and mold issues that you can run into, and that level of expertise that you need. So if you set it up kind of the way you guys are, as this kind of skeleton, and then being able to import from overseas, I think it's very strong at the moment instead of trying to outlay all that money.
I'm definitely, one thing my time in Washington State definitely taught me is that I don't want to be a farmer. So it was not only do I not want to be, at the farm washing the grow, but I also just can't be bothered capital raising at this point either. And it's like, I understand that you need capital to do stuff, but we've managed to do what we wanted to do without a lot of it, or, enough that we can personally finance these initial stages. So from our perspective, it's not about being the biggest and the best. It's not about being the largest Australian GMP, blah, blah, blah. And I'm sure that floats a lot of people's boats. But for us, we know that there is people who need cannabis products for their health. We know that not all products are the same. And we know some people really don't, they receive this, I guess, single spectrum or isolated oil type products, and they're okay, but it actually gives cannabis the wrong name when people try it. Oh yeah, it didn't actually work for me, but they haven't actually had a product that really is therapeutic in the sense that it has an entourage effect of all these phytocannabinoid profiles that help people with all different terpenes and flavonoids playing their little part. And we have we have just an exceptionally beneficial position of having easy access to that. Why wouldn't we exploit that? It just made sense to us.
And so your product obviously is a full spectrum product that is given to the medical market here in Australia.
Yeah, so I guess the product comes, should probably clarify a little bit about my uncle. So he's known as, in the alternative cannabis world from the old kind of school, as Shanti Baba. It's so funny saying that. It just sounds so opposite to the clean, crisp pharma culture that there is around it now. But he's very notorious for creating a few very highly regarded strains throughout the 80s and 90s, including White Widow and Super Silver Haze. And
it's worth saying he's a geneticist by trade. He graduated Melbourne Uni aged 19 with a biogenetics degree, and he really has led the way in terms of researching and developing all manner of different strains.
It's actually a
of
science degree, just for clarity.
Yeah,
transparency. But yeah.
Oh, and he, high CBD strains, and all of these different.
Well, I had a chat with him about that the other night. He was the first person to actually cultivate high CBD strains, so as a seed, to cultivate seeds. So he's a little bit upset he didn't take more precautionary steps not precautionary, but in terms of protecting your IP. But at the same time, he's quite a purist, so he doesn't really believe that you can IP plant material. But
it's a little bit different landscape 20, 30 years ago than it is today.
Yeah, absolutely. But essentially, he supplies a large percentage of the world's CBD genetics, or initially did at least. So it's and that's still a very strong, making sure that the product comes from a high quality genetic source is paramount. I mean, it is very important to have your agricultural farming practices. It's kind of like nature versus nurture. You definitely need farmers that know what they're doing and are very experienced cannabis growers, and makes a huge difference to your end crop, the conditions. But you also need good input material. So it's definitely that 50-50 nature nurture, and we just know we've got the nature part sorted. He's also an excellent grower, but as a result, we're able to kind of piggyback a little bit off the operation, to be honest, and it's been brilliant. It's still a lot of work, but it's
and really set up kind of like an Australian shop for the family business, and it's something that up until probably a year ago, we were still looking at the best possible way to sort of enter, and we were looking around at all these different cannabis companies that make up the landscape in Australia. And I know Mitch and yourself, Josh, touched on it before, but our business model is obviously completely different to theirs. We haven't got investors that are handing over tens of millions of dollars to us for processing facilities, for farms, for any of this sort of stuff. We have the products developed in the EU, 30 years of experience of genetics, research and development. So we're really just here to set up a shop in Australia and give good quality cannabis products to the market, both wholesale and finished goods.
Yeah, I think it's a really good model, because a lot of these guys, these mostly larger institutions that actually could go raise money on the stock exchanges, either in Canada or in the US, are trying to control that whole vertical. And they're just, you can see it right now, they're kind of spread too thin. They either can't get started in certain areas, or they're just having problems. Some of them are adjusting right now. You're starting to see it, and they're starting to form partnerships and fill those gaps. But I think if you stay lean and agile, then I think you'll end up winning. And so that's where I was intrigued by. First of all, I was intrigued by Mitch's background in the industry and that connection that you just outlined. And then Andrew just being able to think and act like a lawyer in this day and age in this industry is very beneficial, just because of the compliance that's going to be needed throughout the development within this sector. So that's what just really drew me to you two. And I just wanted to keep on developing that conversation. But where do you see, I guess, the Australian industry heading, and where are we now? Like, I guess, where do we come to, and then where are we now, and where are we heading with it here in this, I guess, Asia Pacific region, or Australia, New Zealand are somewhat linked, but they're also forming their own legislation.
Yeah, well, the regulatory environment, I think, is evolving. It really first started when Victoria, back in 2016, decided to open up access to medicinal cannabis. And like a domino effect, you saw all the other states and territories follow. And, because of Australia's membership of various international treaties and conventions, of being a signatory to those on narcotics and the like, that's all dealt with by the Commonwealth government. So there needed to be an adjustment of various Commonwealth laws in order to harmonise with all of the state regimes around access to cannabis. So it's been a really interesting last few years to see all of that play out, and certainly something that, at the end of the day, the patients who need these medicines and who actually derive a therapeutic benefit from these medicines, it all came about because of them and all of the lobbying that they did to government. So, those people are to be congratulated, and all the mums and dads and carers. I know a lot of effort went in Victoria, and I'm sure the same in other states and territories. And so now we're at a flashpoint where we have an industry, we have people supplying products, and we have a growing list of patients who are receiving prescriptions. Because it's worth remembering that almost all medicinal cannabis products in Australia are unapproved goods, and that just means they're not approved by our access to medicines regulator, the TGA. So the TGA, I think over the next few years, it will start to approve medicinal cannabis products once the manufacturers can demonstrate quality, safety, efficacy, and you'll see those products become listed on and registered on the Australian Register of Therapeutic Goods. But that whole process can take many years and a lot of money to run clinical trials, and I know a lot of collaboration is being done between big cannabis companies and universities, hospitals. So that's going to be something to watch. And I think as well, just the access to CBD products will open up because, it's already being talked about. I'm not sure whether this, I can't say for sure if it will occur, but I think there's a lot of hype about the possibility that CBD will be descheduled from a Schedule 4 to a Schedule 3, which just means you'll be able to go to a pharmacy and obtain CBD products. But of course, anything with more than 2%, I think it's, anything with more than 2% THC or other cannabinoids pushes it into Schedule 8 territory. So all of those common cannabis products that have, less than 98% CBD will still be Schedule 8 and will still require a prescription. So in my view, we've still got a way to go. There's also, offshoots like how we deal with people who are on these medications getting picked up by police for having drugs in their system. I know that in Victoria, at least, we've got Fiona Patton in the upper house who's doing a fantastic job with her advocacy around that issue and introducing mandatory standards of, similar to blood alcohol, having those for cannabis as well. Because, it seems a bit rough that you could be, prescribed a really strong opioid medicine and be completely out of your mind. But according to the current laws, you're able to get behind a motor vehicle. But if your medicine has 10% THC in it, very minimal psychoactive component of the plant, and that gets picked up in a drug test, you're in a lot of trouble. So there's lots of things to watch out for. And
it's high, unless you meant 10% of total cannabinoids. But you're right. Just to cut you off and break your train of thought there. I think something like, from our perspective, there's definitely, people in the industry that are much more knowledgeable than us that stay right up to date. We stay across, current affairs in the space. We don't purport to be experts in the field. There's, we follow people like Adam Miller and Reese Cohen and the other people in the industry that we keep up to date with our ASX kind of announcements and just see what's happening at a very kind of surface level. But beyond that, we're just kind of making sure that we can bring products. We know a lot of people that really want and need, in a lot of cases, products that work to really improve their quality of life. And it's not really about being the biggest or best. It's about servicing a group of people within our community, especially locally, that we know that are in desperate need of receiving these medicines. And we're just using whatever tools we have within the law to actually get them these products. And that's really where it stems from. We're not trying to be, a kind of canopy or Medipharma. We're not trying to be that massive conglomerate. We just want to help the people that we know around us, and we know we can do that with these products.
I don't think you're giving you guys yourself enough credit. You guys are actively, from my understanding, bringing in product to the Australian market from overseas. You've navigated that legislation, and you're compliant in the eyes of the Australian government, which is some of the most strict regulation you're going to find internationally. And you're actively bringing that product in and supplying that to people here in Australia. So, and for two individuals, young guys like yourselves, to be able to do that, I mean, that's quite a feat. You're going up against big publicly listed companies that have millions of dollars and tons of resources and C-levels and compliance officers and biochemists and all these kinds of things, right? So I think for two young guys, I mean, yes, you have the resources to reach out to and those relationships built, but for two guys to set that kind of operation up in a country like this, I think is a tremendous feat. And I don't think you've realized what you actually done, because a lot of these guys are bigger organizations, and even the smaller guys, I can assure you, they're not getting that far. They're like you were saying, you haven't gone out and raised money and set up grow operations. These guys are trying to navigate the industry. They're trying to figure out lingo and regulation and how they're going to grow it or how they're going to extract it or where they're going to position themselves in the industry. You already have a good position for yourselves, and you're sticking to it. So, yeah.
Josh, look at it.
I think it's a lot of that's really a testament to Andrew's legal prowess. He's really the one holding the reins on the compliance, and that's a lot of what it comes down to. And I don't want to distill it down too far and take it away from Andrew's efforts, because they've been epic over the last year. But in Australia, yes, it is definitely, from what I understand at least, it's definitely one of the most stringent kind of set of rules that you have to abide by in order to supply this stuff. However, unlike some other jurisdictions, it's very clear cut in Australia. The law is the law, and you just follow each of those lines. And if you do the right thing, they will allow you to bring in product. Whereas that's not always the case, or it's not always so clear cut in other jurisdictions, including North America. So on one hand, you can view it as very taxing and tough to navigate, which it is, and it took us months, if not the better part of a year, to actually figure it all out. But at the same time, if you do the right thing, that they will reward you for it.
Yeah, and just to tack on to that point, I have found that the multiple governmental agencies that we've dealt with in our journey to date, so we first got our license to supply Schedule 4 products from the Victorian Department of Health. We now have a Schedule 8 license on the way. And then what was next? Then we applied for our import license from the Office of Drug Control, and
don't give away too many trade secrets.
Yeah, since then, and then you have, of course, the just while I'm on a roll, Mitch, the medicines regulator, and then Border Force. There's lots of government agencies that we've dealt with, and I have to say that each of them obviously has their silo of what falls in their wheelhouse and what they're concerned with. But I think, given that this industry is emerging, and the regulators themselves probably feeling that this is just as new as it is for the participants in the industry, I have to say I've found the regulators to be wonderfully helpful at each step of the way. They've actually, genuinely provided a lot of assistance and guidance. I think we have a very good regulatory environment in Australia.
Well, I think it took me a while for me to figure out Australia and regulation and how everything is very clear cut. And, I come from a country in the United States where everything's gray, laws, business, everything there's always a wiggle room in the United States. There's room for debate. In Australia, there's no room for debate. Either you did it or you didn't do it. And it took me a long time to figure that out and how it really operates here. But if you end up going to a judge or something, they're going to say, did you do it or did you not do it? And that's Australian regulation. It's very clear cut. They're by the book, and they're going to cover themselves in setting up that regulation. So it took me a while to figure out that whole thing, but you end up liking it because there's no wiggle room.
And I think as well, it's a little bit easier here because of the cooperation between the states and the Commonwealth governments. Just at least, when you highlighted America, and I think Mitch may have also experienced it, but the FDA is that the agency? Is it the FDA that? It
could be the DEA, it could be the FDA. It depends on where you're operating in this industry.
Yeah, it doesn't approve it.
So they like the fact that you don't have harmony between the federal and the state laws over there, I think can cause lots of headaches. Certainly at least trying to get product from there exported, and then it's just something we haven't really looked into because it seems a little bit unclear.
It's a mess. It's an absolute mess over there. And I operated over there for a few years, mainly in the banking sector because it is federally illegal. And then the individual states are making up their own rules, their own regulations, and they're not unified.
Even that's so silly. In fact, at any minute, theoretically, you could just be raided by the, by the feds, and they're like, this is illegal, which technically it is. It's crazy.
Yeah, and you saw that. I saw that throughout the time I was growing up in high school. You saw it throughout the changes in presidents. So you saw from the very conservative Republican parties. Once they came in, they were sending in raids to these more liberal states. It's been a mess within this industry. But on the other hand, the U.S. has pushed the pace of the industry and really shown that tax dollars can be made and that a regulated market can happen. And so it's kind of opened up the eyes of the rest of the world, including here, which Australia does turn its eyes to the U.S. to say, hey, let's look at this. Let's see how they're doing it. And Australia just take pieces and try to set it up from there.
Yeah. It's more like, they've given us the green light. Let's make it, but actually a system that works.
Yeah. Arguably. America's got just like the sheer variety of different products that are on the market over there in the states that have legalized it. It's just amazing. I think that's one area that I really hope that Australia one day has a similar setup. I mean, I'm happy to go on the record saying this, but carefully controlled. I'm a big advocate for legalizing recreational use. And when I was in Oregon a few years back, went into a dispensary and it was like it just blew my mind. I wonder if we'll ever see this in Australia.
Well, I think if New Zealand goes the way that it's going, I think that's going to shed some more light on the industry as far as a recreational model will come about. And so then from there, it will just be all about tax dollars. And if we see that it's well regulated and that it can happen in such a closely tied country as that, then I think Australia will follow suit. And not too much. I mean, it'll take time, but eventually it'll get there.
Yeah. And it may be that, again, they have to just, relax the Commonwealth laws to allow the states to lead their own laws, rather than doing it as a blanket Commonwealth approach. But yeah, it's going to be really interesting to see how that debate goes. But I think as a starting point, I think we still have quite a few years to run where it's, only available for medicinal purposes.
And so I guess to turn back onto that international dialogue, where do you see these different certifications playing in as far as GMP or non-GMP or EU GMP, and where is Australia positioned with that? And how does the legislation kind of fit into that here in Australia, and what's going on with that in your guys' eyes?
Well, Mitch, do you have any? I might bring you in on the EU and some of the international standards.
Yeah, I mean, there's a lot of product that's seems to be coming from a lot of different places. All the stuff that we deal with, luckily, is all made and manufactured in the EU. So, and it's all manufactured not only under GMP but under pharmaceutical GMP. So we're pretty happy and confident with the product that we have, adhering to all TGO 93, TGO 100, any other TGOs in that kind of bandwidth of 10 there that you can think of. And then,
Mitch, sorry, just to jump in, because I'm interested. I remember you telling me when you were in the States that there were all these operators over that way that do private certifications, and maybe, like, how does that differ?
Well, yeah, it's different. So, for example, the product that we get from the EU is state or nation, however you like to say it, GMP certified. So it's the facilities that do the GMP certification are actually verified by the state. So their practices, their controls are all monitored and by a centralized kind of body, that being the nationals, standards for pharmaceutical grade products. And that's from a country we get it from, which has an MRA, a mutual recognition agreement with Australia, to say that they have the same standards that we do. But in the States, they don't quite have that. And when I was over there, I remember they're all independent labs that test your product, and it seemed to be that the labs that gave you more favorable readings were more popular. So, and that can be dependent on a whole host of factors that come down to how they tested it, what method they used. But it just doesn't give you a lot of confidence in the market. And what we're seeing is that a lot of this stuff is making its way to Europe and then trying to pass off to the rest of the world through Europe as not necessarily as anything other than it originally is. But there's a lot of product that's going from America that isn't what it purports to be, because you've seen this massive green boom in the States, and then all this product, just everyone's like, all right, now we've got to grow weed because that's the next gold rush. And they've all done that, and there's just this massive oversupply, and the price has bottomed out of the States, and there's just a heap of product, and some old product and moldy product in some cases. And a lot of this stuff is just being cleared because it's the financial burden they now have and the excess stock. So some of it's making its way to Europe very cheaply. Some of it's being used as biomass. Some of it's being sold at all different stages. And some of it's not exactly what the COAs say. And when they're being verified by state labs in the EU, they're coming up real short, and they come in at these amazing prices and really cheap and amazing sounding deals. But when you do the tests, they're not actually checking out. So not in all cases, but it is happening.
There was that hemp farm bill that came through in 2018 that really opened up that CBD market in the US, and it kind of was a free-for-all for all farmers to transition into hemp if they wanted to, and then they could grow that hemp into an extractable product, and then it just flooded the market where there was no real necessarily a demand for that much product. And so very interesting to see. You kind of saw this, there's quite a few different markets in the US. There's the recreational, there's kind of a medical, a pseudo medical market, and then this nutraceutical, there was that nutraceutical side that started to open up, but it ended up just kind of plummeting the price of everything. And there's just, I've heard of just fields just sitting there rotting because they can't they're not even harvesting. There's no point to.
There's also people selling CBD oil in the States. What was that case recently? I can't remember which company it was, selling CBD oil that didn't have any CBD in it. Just oil.
Yeah, they're just like cold pressed hemp oil or something, you know.
Oh, yeah,
I cook with one of those. I cook with it. It's called olive oil. Doesn't have any CBD in it.
Oh, that's why you're always high.
So as far as there's the GMP standards, but then there's also APIs. What's your knowledge or what's your understanding of APIs in this industry and the need for, I guess, organizations in Australia to have that as a part of their curriculum to source their wholesale product?
API is an interesting one. It actually depends on, it becomes an API depending on the end use at the different points in the cannabis life cycle or extraction kind of life, if you will. But API, yeah, look, I mean, there's a lot of people that want API to make their own if they have a manufacturing license in Australia, or if you're a pharmacy, compounding pharmacy or something like that. But as we kind of briefly touched on before, if you're making a single spectrum isolate oil, you're not really doing anyone a great service, I don't think. It's definitely better than nothing if you don't have anything, but there is enough product out there that has a better kind of phytocannabinoid profile, and that's going to be much more beneficial. So it's an interesting one because it's a debate between classic, and I'm not a pharmacist or pretend to be a chemist of any description, but traditionally you isolate a compound that has a therapeutic effect and then you replicate that. But what we're finding in a lot of literature is that the entourage effect, as many know it, or the mixture of different compounds within cannabis make it more effective than if you just use CBD in isolation or THC in isolation from anything else. In saying that, there's probably a scientific reason behind it. It isn't fully explored yet. There's definitely a lot of work being done on, which terpenes, linalool, myrcene, like all the. There's probably a mixture and a scientific reason that each individual one together has some kind of therapeutic effect, and we just don't know the exact amounts of each that has the perfect effect for Parkinson's or perfect effect for epilepsy, for example. But, we do know that it does require some of those to work in harmony for it to be even more effective. And so API, unless you're getting API of more than just that single compound, which at the moment sounds like hard to, I haven't even looked into that, but it's probably a pretty interesting task at the moment. Then, yeah, I mean, go for it, but that's not really where we're at personally.
I came across that whole entourage effect. I find it interesting because in the US, it's very well known, the difference between indicas and sativas. And they were doing a sleep study over here. And I asked the question, and I think it was like on a LinkedIn newsfeed, and they were publicizing this sleep study with cannabis. And I said, hey, have they looked at the difference between the effects of sativas and indicas within the industry? And they're like, they pretty much had no idea about these two types of plants, and they're just merely looking at the plant as a whole. In the US, it's very well known that one will keep you up and give you energy, and the other one's going to put you to sleep, and you're going to feel drowsy and tired. And I think that comes back to that entourage effect, is that certain plants and certain, I guess that would come back to an agronomist to understand those types of compounds that are going to be, or a biochemist, what's going to be in those different types of plants, and how much CBD, how much CBG, or anything like that.
Yeah, absolutely.
Yeah, well, typically, the reason behind that is, so you look at your indica plants, they're usually places like Afghanistan, a bit further from the equator, where it's slightly colder, and they need bigger, heavier kind of protection from the elements. So they breed this kind of heavier, in turn, effect on the person who takes that. Whereas the sativa, the longer, thinner leaves, typically have that racier, more creative, uppity champagne kind of effect. And they don't need as much heavy duty protection because they're close to the equator on the actual plants themselves. So you get this lighter kind of feeling about it. But I guess that's reflected mainly in, again, the terpene and flavonoid profile, because THC is THC, THCA, THCV, and CBD, basically all of CBG, CBN, CBC. They're all just what they are, but it depends on the indica or sativa as to which kind of what allotments of those compounds are in each strain.
As far as I've seen prices vary internationally. I guess that's kind of my realm, is the understanding the price points of flower, of CBG, of CBD, THC. You're just seeing a flood internationally, it seems like, of various products. We were kind of touching on it about in the North America market. It's just this race to the bottom. How do you see that holding up internationally? Do you think the GMP standards will hold up prices? Do you think certain compounds will hold up prices? Or do you think it's a race to the bottom like in most states in the US? So I was working in Washington State, which is kind of isolated. You can't move product in or out of Washington State. So you only have a certain amount of producer processors, and you got a certain amount of retailers. And so I'm just imagining that scaled out to the rest of the world now. If you have all these guys internationally coming in and they're producing this at scale, does the wholesale price of cannabis end up becoming nothing? Like, how do you see that eventuating?
I do think that it is a slower race to the bottom. You've already seen prices come down in the last year or two dramatically, especially with stuff like isolate or even distillate. And they're projected to continue getting cheaper. But in saying that, it'll come down again to the end user and the effects that they're getting. Are they getting a therapeutic effect? That's what it's going to come down to. I think somebody who is, I can't say this with absolute certainty, but I think somebody who's getting genuine quality of life back and a greatly improved medical situation for themselves is always going to spend a bit more money if they have to on a product that works versus something that doesn't. So that's why we feel confident with what we're doing. It's not to say that there aren't more products like that out there. There definitely are. But I mean, coming even back to that last question around indica and sativa, that we have quite a highly uneducated market in global terms. Well, at least compared to America, for example, not knowing the difference between indica, and people don't know the difference between isolate, and they think, oh, can I order some isolate, to take it home? And it's like, well, no, that's not quite how it works, but we really don't know. And if you ask most people about their smoking weed growing up, like I'm like, oh, what did you know what you smoked? Like, do you know what strain? Do you know what kind of the background? They're like, oh yeah, it was weed. You're like, yeah. And they're like, yeah, we smoke. Yeah, I've smoked weed. But you're like, wow, they're so different. Each plant, it's like, did you have a glass of red wine or did you have tequila? Like, it's a very different experience. They're both alcohol, but I think it's even more pronounced in the cannabis world. And it's, I think, going to take some time for us to catch up on the education piece with that, because especially the, I guess, black market, it's still like that. People don't have that level of understanding about the differences or the minutiae involved in smoking cannabis, all through to taking it medicinally.
Yeah, and I think as well, just to tack on to what Mitch was saying, it's absolutely, it will come down to whether or not the product works. But I think in Australia, because we don't have a hybrid medicinal and recreational industry, there's been a lot of, I guess, a huge focus on producing pharmaceutical grade products here in Australia. And so I can certainly see from discussions with various industry participants that having end-to-end GMP is really important to them, because even a lot of state governments are invested in this industry and its export potential. So I think you're going to see Australia being a leader of export of pharmaceutical grade products, and in order for those to be seen to be the best, there's going to need to be that end-to-end GMP certification right through. So I think GMP is important, but I think it sort of depends in which context.
Of course. I think GMP, having those standards throughout your supply chain, is going to hold value for the product comparatively to other markets which are doing it food grade or doing it, whatever.
I really believe that for recreational or even novel food, maybe there's an argument to be had about needing GMP end to end for novel food. But I think for recreational CBD drops and things like that, I don't think the end user's too fast necessarily. It's not to cast aspersions, but I think it's obviously imperative for pharmaceutical grade products that they are. And we certainly, like all of our products are, to a standard of EU GMP, so, and comply with all of that. So it's important to us, it's important for our products, and for, I would think, most of the Australian industry participants.
The other thing that I think will hold up that price in certain jurisdictions, and you saw it in the US, in certain states, like Nevada, there's only a certain amount of licenses that could produce the product. And so those licenses, if they had the right license type, it really held up the value in that supply chain, depending on how many licenses were granted. At places like Washington, they just gave out far too many licenses to produce their processors, and it really just drove the product price down to nothing, and people couldn't make a profit on it. On one side of the coin, on the producer processor side. On the retailer side, they were making the margins because there was fewer retailers. And so I think depending on the jurisdiction you're operating in, that will determine how many licenses are there, and then that will also determine the price, or a factor in the price of where that's being sold.
I'm a bit skeptical about that, just because then you create a license market where people are then buying and selling licenses in order to gain entry to the market. So I'm typically probably more a fan of just anyone who is keen to do it and is
free market,
researched enough. Yeah, I knew you were going to say that. I'm not a right-wing libertarian, but in this context, I don't think government licenses really they just it just creates another market, and it's difficult. Like if Mitch or I had the audacity to want to start an operation in Nevada, we'd then have to bid for a license or do something. And to me, based on our approach in the Australian market, we'd rather just a government that allows us to do it ourselves, and as long as we're compliant, that we should be given that opportunity.
Yeah, that's an interesting one right now. We're kind of seeing this really weird disease come about, and we're going to see how governments respond to a trade. I mean, I think it's going to come into this. Do we hold manufacturing back at home, and do we regulate that market and try to create jobs back at home, or are we going to allow China to do what they've been doing and take a lot of this money from our countries? So we'll see how that all develops. But I think that's a very pertinent conversation at the moment of how that should develop.
Yeah.
Guys, I'm going to end up, I'm going to jump off, but I wanted to thank you guys for coming on, and I really appreciate your time. I'd like to do this again, and take this kind of to the next level.
Sure.
Maybe next time in a few months as things start to open up, I think, around the world. And maybe, just dive into some more details about what's going on domestically and abroad.
Absolutely. We we didn't even get an opportunity to do a plug for all of our products, so we'll save that for next time. We get invited back.
You guys are always at the top of my list for your products too, so I'm trying to connect you guys with the right people. But Mitch and Andrew, you guys are just I think a great resource here in Australia. Somebody that the industry should get to know further, and just a wealth of information.
You dropped our business name as well.
CBD Pharma. You could say that, where to find you and how to contact you.
Always happy to chat with anyone. We like a little bit of a spiel.
Yeah, cbdpharma.com.au. Have a look. But so also want to give a plug to Josh, because the Australian cannabis marketplace, and let's delve into that on the next call. But I think, if we can perhaps flip the microphone and have a quick chat to you about that, because I think it's a great thing that you're doing as well, connecting all these people in the marketplace. So maybe we'll get to that in the next call.
No, it sounds good. Sorry to cut it short, but I think we've been talking regularly, and we can pick this right up again. So I thank you for your time.
Absolutely. Thank you, Josh. Looking forward to the next one. Take care.
Thanks, Mitch. Bye.
Cheers.